Lassa fever. It sounds distant, a disease found in far-off lands, but this viral illness can strike with a suddenness and severity that brings global concern. Lassa fever is not just any fever, it's a form of viral hemorrhagic fever, a class of diseases infamous for their ability to cause widespread bleeding and immense suffering. Lassa fever predominantly affects West Africa, where tens of thousands of new cases occur each year. While most people experience mild symptoms like a fever or sore throat, 1 in 5 infections escalates into a life-threatening condition, marked by severe bleeding, seizures, and organ failure. Perhaps most tragic is the threat Lassa fever poses to pregnant women. With an incredibly high rate of fetal mortality, over 75%, and serious risks to the mother as well, these high-stakes statistics underscore the reality that, in areas where Lassa fever is endemic, a simple exposure to an infected rat's waste or contact with an infected individual could result in life-altering consequences. At Doctor Mai, we're dedicated to unraveling these complex health threats, educating viewers on essential prevention measures, and sharing insights that can protect both you and your loved ones. So, as you learn more about Lassa fever, we invite you to like, subscribe, and comment on our channel. Your support fuels our mission to bring critical health information to the forefront, potentially saving lives through education. Lassa fever is a viral hemorrhagic illness spread by the Lassa virus, which is primarily transmitted through contact with the urine or feces of infected mastomys rats, a common rodent in West Africa. The virus may also spread between humans, especially in healthcare settings where protective equipment and sanitation practices are insufficient. Once infected, some individuals may exhibit mild symptoms, while others face a much more severe course of illness. In the vast majority of cases, the symptoms are mild and can be mistaken for other illnesses, leading to potential misdiagnosis. These mild symptoms include fever, headache, sore throat, and fatigue. However, in roughly 20% of cases, patients experience severe complications, including hemorrhaging, chest pain, respiratory difficulties, and even confusion or seizures. For pregnant women, the stakes are even higher, with Lassa fever often leading to miscarriage and posing severe risks to the mother. In addition to the physical risks, the unpredictability and severity of Lassa fever can lead to psychological distress for affected individuals and their families, making the disease an all-encompassing health crisis that strains both physical and emotional resources. The primary source of Lassa virus transmission is the mastomys rat, which thrives in the regions of West Africa where Lassa fever is most prevalent, including Nigeria, Sierra Leone, Guinea, and Liberia. Infected rats excrete the virus through their urine and feces, which can contaminate surfaces, food, or even open wounds. While people often contract the virus through accidental exposure to these contaminated materials, person-to-person transmission can also occur. Healthcare workers are particularly at risk, especially if they lack access to personal protective equipment like gloves, masks, or goggles. In situations where sanitary practices are challenging to maintain, such as conflict zones, displaced populations, or under-resourced healthcare facilities, Lassa fever can spread more rapidly, creating public health emergencies. Protecting healthcare workers and ensuring adequate sanitation and education about disease prevention are critical to preventing outbreaks. The range of symptoms associated with Lassa fever complicates early diagnosis, as it shares symptoms with diseases like malaria or Ebola. For about 80% of those infected, symptoms remain mild, including fever, fatigue, sore throat, cough, and headache. These symptoms can resolve on their own, making it difficult to identify Lassa fever without specific tests. However, the remaining 20% of cases take a more severe turn. Symptoms may escalate to include intense abdominal, chest, or back pain, vomiting, often severe enough to cause dehydration, uncontrolled bleeding from the mouth, eyes, or nose, seizures and neurological impairment. Among the most concerning complications is the high rate of hearing loss associated with Lassa fever. Affecting nearly 1/3 of infected individuals, hearing loss can be either temporary or permanent, dramatically impacting quality of life even for survivors of mild cases. Other severe complications include liver inflammation, respiratory distress, kidney failure, and the risk of sepsis, a life-threatening immune response to infection. The mortality rate of Lassa fever varies, but it is significantly higher for those who require hospitalization or are pregnant. Studies estimate that up to 15% of hospitalized patients with Lassa fever may not survive. The risk is even graver for pregnant women, with nearly 1 in 3 fatalities among those infected. These statistics reveal just how critical early detection and treatment are, particularly for vulnerable populations. Early diagnosis is essential but challenging due to the broad range of symptoms that overlap with other illnesses. Healthcare providers typically diagnose Lassa fever by testing bodily fluids such as blood or urine for signs of the virus. Diagnostic tests may also involve throat swabs or, in severe cases, a lumbar puncture. Given the challenges of accurate diagnosis, it's vital for patients to inform their healthcare providers if they have recently traveled to regions where Lassa fever is endemic. Treatment for Lassa fever often includes the antiviral medication Ribavirin, which has shown promise in reducing mortality when administered early. Other treatments focus on supportive care, such as intravenous fluids, electrolyte replacement, and, in severe cases, oxygen therapy or dialysis for kidney support. For pregnant women, rapid and aggressive intervention is crucial to increase survival chances, and in cases of fetal loss, early delivery may be necessary. Reducing your risk of contracting Lassa fever begins with preventing exposure to rodents and enhancing hygiene practices. In regions where Lassa fever is common, keeping living spaces clean, storing food securely, and discouraging the presence of rats can minimize exposure to the virus. Those in healthcare settings, particularly in endemic areas, should take extra precautions, using PPE and strict sanitation measures to limit contact with infected individuals. For those considering travel to affected regions, consulting with a healthcare provider or public health expert about Lassa fever can provide invaluable guidance on preventive strategies. Additionally, raising awareness about Lassa fever's dangers can help communities and families take appropriate precautions. If you found this information valuable, consider subscribing to Dr. Mai for ongoing content that delves into complex health issues like Lassa fever. By subscribing, liking, and sharing, you're helping spread awareness that could save lives. The prognosis for Lassa fever depends on various factors, including the severity of symptoms, speed of diagnosis, and access to medical care. Most patients with mild cases recover within a week, while those with severe illness may require longer treatment and rehabilitation. Hearing loss is a common long-term complication, but half of affected patients regain some hearing over time. While Lassa fever's survival rate is high for mild cases, the mortality rate for hospitalized or pregnant patients remains a significant concern. This reality makes it all the more important to recognize symptoms early and seek medical care immediately if you suspect exposure to the virus. Regular monitoring and follow-up care can be critical for managing long-term effects, particularly in preventing hearing loss and monitoring organ function. Lassa fever represents a complex and significant health threat, particularly for people in West Africa. Through this article, we hope to shed light on the importance of awareness, prevention, and timely treatment for Lassa fever. At Dr. Mai, we're committed to delivering life-saving health information, and we encourage you to stay informed by subscribing to our channel. Together, we can build a community focused on health and well-being, working towards a world where preventable diseases like Lassa fever no longer pose a threat to individuals and families. Join us on this journey of knowledge. Like, comment, and subscribe to Dr. Mai for more insights into global health concerns.